Trachoma, a neglected tropical disease and the leading cause of blindness in the world. My name is Melody Sabani.
And I'm Iris Rivera.
And today we're going to talk to you about the disease trachoma. Trachoma is an infectious disease that is caused by the bacterium Chlamydia trachomatis. Trachoma is the leading cause of blindness in the world and occurs in the most underprivileged developing countries with very poor living conditions. This video will be an in-depth explanation of trachoma, what causes trachoma, perpetuates it, some of the signs and the symptoms, and a current evaluation of trachoma in the world and what efforts are being made now to do something for the future of trachoma.
Now just a few facts on trachoma. It is endemic to 57 countries around the world, with Africa having the greatest impact. Trachoma was once endemic here in the US as well, but has seen a drastic decrease due to improved living standards. Trachoma causes blindness in 40.6 million people worldwide, which is equivalent to 4.5 times the population of the state of Georgia. 8 million people have visual impairments due to trachoma, which could eventually lead to blindness.
Trachoma is a neglected tropical disease, also known as NTD. Neglected tropical diseases are a group of tropical bacterial and parasitic infections that impact 100% of the poorest countries. NTDs are classified as neglected because these diseases have been wiped out to a large extent in more developed countries. These NTDs cause physical, emotional, and cognitive impairments that perpetuate a poverty cycle. This is because these impairments keep the community out of school, out of work, unable to farm and earn a living, and back in the cycle of illness, unable to take care of themselves. We will talk a little bit more about the poverty cycle in relation to trachoma in a little bit. But a little bit more on NTDs. At least one neglected tropical disease impacts 149 countries and territories. Neglected tropical diseases kill approximately 534,000 people all over the world each year. And 1 billion people worldwide suffer from a neglected tropical disease.
In order to understand the magnitude of an NTD, let me tell you a little bit about the other diseases that accompany trachoma. Buruli ulcer is caused by a bacteria that targets and kills the fat right underneath the surface of your skin and prevents your body from producing an immune response. Large ulcers develop on your skin containing the bacteria. Chagas disease is a disease that is caused by the parasitic rejuvit bugs and is most predominantly seen in South and Central America. This disease has the potential to cause severe digestive problems and even heart failure. Dengue and severe dengue. Dengue fever, or breakbone fever, is a viral infection transmitted by mosquitoes which causes flu-like symptoms. In some patients, severe dengue can develop, most often leading to death. Dracunculiasis, or guinea worm disease, is a disease that is transmitted by drinking water contaminated with copepods or water fleas. These swimming white specks are the host to the Dracunculus larva parasite. The infected guinea worm usually travels down towards the legs, forming a blister that erupts with new infected larvae. Echinococcosis is a disease caused by the Echinococcosis tapeworm. This disease can infect many mammals, from humans to horses, sheep, rodents, and even dogs. Humans are usually exposed to the eggs of the worm through handling of infected soil, dirt, or animal hair. This disease usually leads to the formation of cysts in the liver and lungs that can go undetected for many years depending on location. Food-borne traumatodiasis is a disease that is caused by the parasitic trematode or flatworm. Many of the trematode infections are caused by eating contaminated food, especially from foods with raw fish, crustaceans, and plants. Human African trypanosomiasis, also known as sleeping sickness, is a disease that is transmitted by the bite of a tsetse fly. Once inside the blood, the parasite will multiply, causing severe headaches, fever, weakness, joint pain, and stiffness. Once it crosses the blood-brain barrier and gets into your central nervous system, the disease could be fatal. Leishmaniasis is caused by the transmission of the Leishmania parasite through the bite of a sandfly. Symptoms include a skin sore that may appear weeks to months after getting bitten and can cause the enlargement of the liver. Leprosy is a disease caused by a bacteria with a long incubation time, meaning it is slow to show any signs or symptoms. It affects the skin, mucous membranes, and nerves, which causes discoloration, lumps, and deformities on the body. Loss of feeling in the hands and feet is also very common. Lymphatic filariasis, or more commonly known as elephantiasis, is a disease that is caused by thread-like parasitic worms. These worms can live in the vessels of the lymphatic system for up to 6 years and produce millions of very small larvae. This disease is transmitted by the bite of mosquitoes, causing the inflammation of various body parts, especially the leg. Onchocerciasis, or river blindness, is a disease that is also caused by a parasitic worm and is spread through the bite of an infected black fly. Once inside the body, the worms mate and multiply, with the eventual spreading of the larvae. Once dead, the bacteria will cause a severe inflammatory response, causing blindness. Only second to trachoma, onchocerciasis is one of the leading causes of blindness in the world. Rabies, caused by a viral infection, is commonly transmitted from the bite of an animal, such as dogs. This virus infects the central nervous system, usually traveling to the brain, causing death. Schistosomiasis is a parasitic disease caused by snails and normally occurs in areas without clean water. Once inside the water source, the snail releases the trematode parasites into the water, eventually infecting animals and humans. Soil-transmitted helminthiasis is a group of infections caused by intestinal roundworms. They are transmitted through nematode eggs in the soil and are most common in warmer climates. Taeniasis and cysticercosis. Cysticercosis is an infection caused by a parasitic pork tapeworm that creates cysts in different areas in the body. This disease is caused by the ingestion of the parasitic eggs found in contaminated food. It is especially common in countries with free-roaming pigs. Taeniasis, on the other hand, is the ingestion of cysts from eating raw or undercooked meat of infected animals. The main organ that is infected is the intestine. And here we have trachoma amongst the list of neglected tropical diseases. And last of all is yaws, which is an infectious disease that attacks the skin, bones, and cartilage. It is caused by a bacterium and is not fatal, but does cause disability and disfigurement.
This is the poverty cycle that relates directly to trachoma. It shows how the disease is perpetuated by a series of events that continue the cycle and make it difficult to come out of. The lack of facial cleanliness, mostly caused by a lack of proper hygiene education, begins the cycle and leads to infection and reinfection of trachoma. This heightens the already infected individual or begins the cycle of trachoma to a new person. After blindness is caused, this makes it near impossible for the individual to work or earn a living, continuing poverty. Poor communities usually have a lack of water quality. Sanitation decreases, and this increases the insect population, which increases the amount of vectors that transmit the disease from person to person. And increase of overcrowded conditions can decrease the overall hygiene, leading back to a lack of facial cleanliness.
Trachoma's causative agent is the bacteria Chlamydia trachomatis. This is an obligate intracellular parasite, meaning that it cannot survive without a host, which is us in this situation. The bacteria needs a host to survive because it lacks the ability to generate its own energy, so it obtains its energy in the form of ATP from our cells. Chlamydia trachomatis is also aerobic, meaning that it needs oxygen to survive. Another characteristic of the trachoma bacteria is that it is non-motile, which means it lacks the ability to move. This bacteria is also gram-negative, seen here in the pink, which makes it much harder for antibiotics to effectively kill off the bacteria. This is due to the structure characterized by it being gram-negative. Chlamydia trachomatis can be found in two different forms. One is the coccoid shape, or circular shape seen here, in which it does not replicate and is released when an infected cell ruptures. This form is responsible for the bacteria's ability to spread from person to person. This bacteria can also be rod-shaped, which is here, in which the bacteria is now able to replicate and grow once inside the body.
This is the life cycle of Chlamydia trachomatis in humans, and an in-depth explanation of how it infects our cells. It starts in its infective form, which is an elementary body, and it binds to one of our cells and is taken into the cell through endocytosis. It takes part of the cell's membrane with it and encapsulates itself with it, and this is called the entry vacuole. Once it's inside of the entry vacuole, inside of our cell, then it forms a reticulate body, which is the form of the bacteria that allows it to replicate. And it does this, seen here, by binary fission. Once replication occurs, reorganization of the reticulate bodies back into elementary bodies occurs so that the bacteria can further infect other healthy cells. Once release of the elementary body occurs, reinfection of other healthy cells continues, and apoptosis of the previously infected cell occurs, which is cell death. Now that we know how the bacteria invades our host cells, it is important to know how it evades the host cell. One of the reasons that trachoma is so aggressive is because of its ability for the bacteria that causes trachoma to evade or escape destruction by our body. Let me show you how it does this. When the bacteria enters the cell, it encloses itself in the cell's membrane, as previously mentioned, and this is known as the entry vacuole. Once the cell is inside of the host cell and enclosed in the entry vacuole, it is able to then replicate inside of our cells. Normally, when a foreign invader is inside of our cells, something known as a lysosome approaches it in order to destroy the foreign invader. Lysosomes are a part of our cells that are responsible for waste disposal, but they're also responsible for ingesting foreign microbes that invade the host. The Chlamydia trachomatis bacterium is able to evade the lysosome by projecting what is called a type 3 secretion apparatus. This secretion apparatus excretes secretion proteins, and this makes it difficult for the lysosome to bind to the entry vacuole on the bacteria in order to destroy it. This is one way that the bacteria is able to evade our host's immune system. The second way is through the utilization of lipids from the Golgi apparatus. The Golgi apparatus is another membrane-bound organelle seen on the inside of our cells. The bacterium takes lipids and uses it to disguise itself as a part of the natural organelle found in a cell. So the lysosome believes that the bacterium is actually a part of our normal cell makeup and therefore does not destroy it. This allows the bacteria to replicate, thrive, and eventually escape from the cell, going on to infect other healthy cells and perpetuating this invasion-evasion process.
After infecting and replicating in the host, the bacteria will begin to cause physical damage in the eyes. First, however, I want to show you the normal anatomy of the eye just to give you a perspective of what it's supposed to look like before infection with Chlamydia trachomatis.
Some of the important parts of the eyes that are important to understand are the cornea. This is because this is one of the parts of the eyes that is infected or impacted by the disease. This is the portion in this image indicated by the blue. Another part of the eye that is impacted by trachoma is the conjunctiva. This is not the area indicated by blue, but the clear layer right here on the outside of the blue on both sides and stopping at the cornea. This is called the conjunctiva. And also the inside of the eyelid. The conjunctiva on the inside of the eyelid is also heavily infected by the disease. This is a healthy eyelid, just to show you for comparison when you see future images of the eyelid that is infected with trachoma.
The early stages and signs upon contraction of trachoma includes discharge from the eyes containing mucus or pus. Irritation and itching of the eyes and eyelids is also another principal sign of trachoma, which can induce pain in the eyes, seen here in the red. This is due to the inflammation or irritation of the conjunctiva. As trachoma progresses, sensitivity to light becomes a problem that can cause much discomfort or pain. This is known as photophobia. Another initial symptom many experience is blurred vision, making it difficult to continue with normal everyday activities.
Now it's important to understand the 5 active stages of trachoma. Once infected with the bacteria, a progressed stage of the disease can be seen as TF, which is follicular. And this is seen with the formation of follicles on the inside of the upper eyelid. They form because of a collection of protective cells that the body is putting out in response to the presence of the microorganism. These protective cells are known as lymphocytes, which cause a majority of the inflammation. The center of each follicle has a protective cell called a mononuclear histiocyte, which just means a cell with one nucleus, and also Leber cells, which are much bigger cells with many nuclei. Another stage of the disease is TI, which means the inflammation portion of the disease. This is a stage of the disease that is indicated or characterized by lots of intense inflammation, from the follicles forming and a huge response from the lymphocytes from our immune system. A follicle with a diameter greater than 5 millimeters is only seen in trachoma. TS, which is the next stage, is characterized by the scarring that occurs on the eyelid. They form due to a collection or buildup of dead skin cells from the conjunctiva due to the invasion and destruction by the bacterium, and they look like hard white deposits. This leads to TT, trichiasis, which is characterized by an ingrown development of the eyelashes, or curling in of the upper eyelid. Lastly, CO, or corneal opacity, is characterized by clouding of the cornea. And this is usually because of the ingrown eyelashes in combination with the scarring that occurs on the inside of the eyelid rubbing up against the cornea. And this is what develops from that. This is usually the stage of trachoma that causes majority of the visual impairments and eventually blindness.
Now we're going to talk about a few vectors that can carry the trachoma bacteria. A vector is simply any organism that passes on a disease from one host to another. In trachoma, the bacteria is most commonly transmitted by the musca sorbens fly, which is also known as the bazaar fly. They will cluster and feed on the mucus discharge in the eyes containing the Chlamydia trachomatis bacteria, where it is then transmitted to another host. This clustering of flies is especially seen in children who are more likely to touch their eyes and have unclean faces. They will later spread the disease either by direct contact with another person or by contaminating towels, handkerchiefs, or washcloths shared with others. Even though children are at the highest risk of trachoma, the seriousness of the disease is not realized until adulthood when blindness begins to set in. Another form of transmission that can heavily induce the spreading of trachoma is due to the presence of domestic animals that are kept in close proximity to the home, such as pigs, cats, dogs, goats, and hens. The feces of these animals provide the perfect breeding ground for the flies that then carry and transmit the trachoma bacteria on their bodies, legs, or proboscis, which is the feeding tube.
Now, just to give you a little bit of a background of trachoma around the world.
In Nigeria, since 1995, trachoma was considered the #1 cause of blindness in the Kano state of Africa. This state is actually holds one of the oldest eye hospitals in Nigeria, and yet no community-based measures are being done to help eliminate trachoma. Currently, there is much research being done in this area to help with the implementation of control programs. It has been found that the occurrence of TF, or as previously mentioned, the follicular stage of trachoma, is seen in 17.5% of children between the ages of 1 and 9. This exceeds the 10% threshold for mass distribution of the antibiotic azithromycin, indicating that Nigeria is in very much need of an elimination strategy. Also, the estimated amount of individuals impacted with TT, the trichiasis stage, exceeds over 500,000 adults, with the majority being women. The only treatment available for this stage of trachoma is through surgical means, in which the eyelashes are rotated away from the cornea. However, there are only 15 trained TT surgeons in Kano State, further indicating the magnitude to which control measures are urgently required.
India is one of 5 countries accounting for nearly half of the cases of trachoma around the world. In 1959 to 1963, trachoma was a major health problem for the country, with 56 to 79% of the population having been infected with trachoma. Most of the people infected with trachoma were under the age of 10. WHO, or the World Health Organization, assisted in mass antibiotic distribution to get the problem under control, which catalyzed the formation of TRA, Trachoma Rapid Assessment, to prioritize trachoma as a major health issue in India. In 2006, 5.8% of children ages 1 through 9 were infected with trachoma, and 0.15% with trichiasis, which is a huge reduction of the main public health problem in comparison from 1959 to 1963. Currently, in socioeconomically disadvantaged Car Nicobar Island off the coast of India, with a population of 17,967, trachoma is still active. TRA assessed 10 out of 15 villages on the island, which was 7,277 people, and found an infected rate of 50 to 58% of people infected with trachoma ages 1 through 9, and 1% of the population with trichiasis. Innovative public health approaches are being administered by the World Health Organization to control the problem. SAFE is a strategy that is endorsed by the World Health Organization and is a public health approach designed to prevent and treat trachoma. SAFE is an acronym, and every letter stands for an aspect of the approach. S is for surgery of the intern eyes, also known as trichiasis. A is for the application and distribution of antibiotics to stop the infection. F is for facial cleanliness, which is a vital component in stopping the trachoma transmission cycle. E is for environmental improvement or environmental change, to increase the sanitation of the environment and to increase access to cleaner water.
Now we're going to talk about some drugs that are widely used towards the treatment of trachoma. Azithromycin is the first-line antibiotic or first-choice antibiotic that is administered to those infected with active trachoma. It is given as a single oral dose of 20 milligrams per kilogram and is safe to use in children as young as 6 months old to women in pregnancy. This antibiotic is the preferred drug due to higher effective rates with only a single dose than seen in standard treatment with the application of tetracycline ointment over a 6-week period. The way azithromycin works is by preventing the growth of the bacteria by hindering its protein synthesis, or its ability to generate its own harmful proteins. Although this antibiotic is known to be a bit pricey, the company Pfizer actually donates azithromycin, known as Zithromax, in the effort to eliminate blinding trachoma.
Tetracycline is another antibiotic used to treat trachoma and is second in line to azithromycin. Unlike azithromycin, it is not safe to use on children under 8 years old, which is not good since trachoma infects a lot of children. Tetracycline combats the bacteria by blocking its ability to produce proteins. Tetracycline is also marketed under the brand names Samycin, Tetracin, and Pinmycin. PRET, which stands for Partnership for the Rapid Elimination of Trachoma, is an organization that is partnered with the World Health Organization and assists in efforts to eliminate trachoma in the future. Now we're going to talk about some of the organizations that are assisting in the future of trachoma and elimination of the disease. PRET's main focus is on the S and the A aspects of the previously mentioned SAFE strategy. S standing for surgery and A for antibiotics. They have named this focused effort STAR, which stands for Surgery for Trichiasis, Antibiotics to Prevent Reoccurrence.
There are 3 separate studies that make up STAR. Study 1 is the antibiotic study in which mass treatment is performed with azithromycin. Currently, this study is taking place in Tanzania, Niger, and the Gambia over a span of 5 years to evaluate the effectiveness of azithromycin. Study 2 is the ancillary study, which also focuses on administering azithromycin, but is geared towards the treatment of other diseases such as malaria, relapsing fever, diarrheal diseases, acute respiratory illnesses, and sexually transmitted diseases. The goal is to quantify the benefit of using this antibiotic and to advocate for more support and funds towards the elimination of trachoma. Study 3 is the surgical study, in which the focus is to see if the recurrence rate of trachoma can be decreased with the use of a new surgical instrument called the trachomatis trichiasis clamp, or TT clamp. With this new surgical method, surgery will become widely available at low cost and will also decrease the time it takes to perform the eyelid procedure to under 20 minutes.
These are some of the organizations that help fund the research of trachoma and also help fund some of the strategies utilized from PRET and SAFE by the World Health Organization, such as the Bill and Melinda Gates Foundation, Orbis, International Coalition for Trachoma Control, Becton Dickinson & Co., the Carter Center, Trachoma Control Programs, and the Helen Keller Institute. In the future, the World Health Organization hopes to eliminate trachoma all over the world by the year 2020. Vision 2020, the right to sight. These are our references.
And in closing, we would like to thank our academic advisor, Dr. Thomas Manning, for his guidance and assistance in the making of this video.
Thank you for watching.